Okay. Hello. Good evening, everybody. Thank you all for joining us tonight to explore Medicaid in schools, one piece of the complicated puzzle of making sure that children, no matter what their needs, receive a high quality education in Ohio. I'm Susie Kaiser. I'm the education specialist for the League and a member of our education committee. And I've been involved at the state level for the last 8 years, and I live in Cleveland Heights, where I've been a League member for about 30 years. Okay.
Would you like to explain the question and answer for tonight?
All right. And your other slide isn't there. Do you know that?
No, I do not.
And you're not in the presentation mode. So if you have questions, be sure to write them in the question section of your Zoom, and hopefully we'll have time at the end to answer questions.
Okay. Can you see it now?
Nope.
All right, let me. Share.
All right.
Okay. Let's try this again. Let's see if it stays. Did that fill the screen?
No.
All right, I had this problem once before, so I am going to have to leave it in.
Just leave it in the other mode. That's fine. Okay. So
Okay, is it there?
no, it's blank now.
Let me make sure.
Okay, let's just go with this. So we have some housekeeping things to pay attention to. We ask that our participants be present, be respectful, and assume good intent. And also that the materials and statements and opinions which should not be shared without the consent of those who are participating in providing that. So a League principle is that all children should have access to a high quality education. Medicaid is a unique resource that our previous work on school funding has left out. Thanks to our invited experts, this education forum is designed to raise our awareness of the state federal resource, so we are prepared to advocate when needed. I'd like to set the stage with some basic information. On November 29th of 1975, 50 years ago this month, Congress passed Public Law 94-142. I was just getting involved in education at that time. This was an important civil rights victory, later renamed Individuals with Disabilities Education Act, or IDEA. This federal law guarantees children with disabilities a free, appropriate public education in the least restrictive environment. It not only granted students with a disability the right to be included in our public schools, but to have an individual education plan that defines how their education will meet their needs. School districts are obligated by law to implement that plan. Each student is unique. Many require attention to mental and physical health or speech therapy and needs that are relevant to all children. Delivering these services at school improves access to care, improves health, and improves learning. One or more of these services is frequently mandated for children with disabilities. Public schools are funded by state, federal, and local sources. Because of the greater cost of meeting the needs of children with disabilities, The state budget creates extra funding for this special category of students. Unfortunately, acknowledging the increased cost is not the same as funding them. One of the many unfunded components of the Fair School Funding Plan was a failure to significantly increase per pupil spending for children with disabilities. About $75 million short of what was needed in the last budget. I'd point out that lawmakers also increased the maximum voucher amount in the two voucher programs that serve children with disabilities to more than $34,000. The federal government also provides funds that target children with disabilities. The federal investment is about 17% of what the cost is. So significant underfunding from the federal government has also been chronic and part of, unfortunately, of the history of this legislation. These shortfalls mean responsibility falls to local sources. In a recent webinar, the treasurer of the Loveland City Schools reported that 92% of his district's special education funding comes from local sources. We know that student needs continue to grow and education costs continue to increase. Yet adequate state spending has been elusive for 3 decades following the DeRolf decision and for many decades prior to it. Instead of solving the problem, lawmakers have made unregulated and unconstitutional private schools and charter schools their funding priority. The Ohio legislature just passed a budget that further pushes funding responsibility to local taxpayers, underestimating underfunding on estimated $2.75 billion. And the feds have already clawed back some allocations and have proposed deep reductions in their spending in the next budget cycle. It's all likely to get worse. Tonight, our program will focus on another funding stream, Medicaid. This federal health insurance program applies to children enrolled in Medicaid who also have an individualized education plan. It's not a line item in a local budget, but an insurance claim, or like one, where districts can seek reimbursement from Medicaid to cover health services provided at school that are required by an insured student's IEP. For many of us who are longtime school funding activists, it's a topic and a resource that isn't on our radar. We decided to hold this webinar to change that. It's a piece of the funding puzzle that is more important than ever as public resources shrink. Medicaid is a valuable resource for school district capacity to offer appropriate services to children with disabilities. This is a critical moment for Medicaid funding of school-based health services in Ohio. State Medicaid officials are in the process of gaining approval to extend Medicaid in school coverage to all children who are enrolled in Medicaid, not just those with a disability. While this is a hopeful moment, it is also perilous. Congress has already started to undercut Medicaid enrollment, which will cut the flow of funds to public schools for healthcare without reducing the need. Children who have an IEP will need services no matter what. Protecting Medicaid is important to making sure school districts can provide every student what they need. So our goals tonight are to make sure we're all familiar with Medicaid in schools, how it works, who it serves, what it funds, and how kids benefit. That we understand the impact of Medicaid on school budgets, that we understand where Ohio is in the process to expand Medicaid in schools, and to understand the negative impact of federal budget changes on Medicaid. Preparing for tonight's webinar has helped me appreciate the larger landscape for thinking about education costs and funding sources, how to think about the complex needs of all of our students and the unique strength of our public system as a resource for providing students multifaceted opportunities. I hope it will have that effect on you too. So I want to thank our two speakers, Allison Paxton and Trish Kwiatkowski, for joining us to share their well-honed perspective on these issues and their commitment to children, meeting their needs and helping them succeed. Allison is based in Columbus and is the National Policy and Program Manager for the Healthy Schools campaign a national nonprofit based in Chicago. She's a longtime league ally, having worked on school funding during her 5 years with the Children's Defense Fund, Ohio. She'll help us with the big picture understanding of health in schools and federal and state policy related to Medicaid. Tish Kwiatkowski is a licensed, aren't I good? Is a licensed occupational therapist and has worked in public schools for 26 years. She's not new to this. Medicaid has been part of her beat for the last 10 years. She serves as a special education consultant for the Akron City Schools and oversees the district's autism classrooms. Her awareness of school funding challenges is also informed by her role as a school board member in the Brecksville Broadview Heights School District. She knows children, special education, and Medicaid. She will illuminate what this program means on the ground in her school district. So, while Medicaid is a federal program, it's also a state program. It's the largest part of Ohio state budget, about $31.9 million, with 69% of that coming from federal Medicaid. So this is really complicated to me. This joint venture is about education and it's about health. It's fascinating and it's complicated. So to get things started, well, we need to turn to Allison, who will provide us an overview of the Medicaid and school landscape from her national vantage point. So Allison, please help us have a baseline understanding of health in schools, Medicaid, and Medicaid in schools. Thanks a lot.
Okay, great. Thank you so much, Susie, and good evening, everyone. My name, again, is Allison Paxson. I'm the Policy and Program Manager for Healthy Schools Campaign. And just thank you to the League for this opportunity. I'm really grateful to be here. And so first, and then our next slide, I just want to share a little bit about the Healthy Schools Campaign, or HSC, in case you're unfamiliar with our work. Healthy Schools Campaign is a national organization based in Chicago, and we work at the intersection of education, health, equity, and sustainability. And this means we advocate for school environments that support all facets of children's health, from healthy, nutritious school meals to access to green schoolyards, healthy school building infrastructure, including clean indoor air quality, and of course, supporting access to and funding for school health services, which I'm going to be talking about a lot tonight. And we do this work in Chicago, statewide in Illinois, and also nationally. And I welcome you to learn more at healthyschoolscampaign.org. And so moving on to the next slide, to really just open up this conversation this evening, I want to share some slides with you to provide a quick foundation for what Medicaid in schools is. And, what is this unique funding model and how does leveraging this program, although complex and at times, frankly, administratively challenging, how does this program present key opportunities and benefits for states and schools to draw down additional federal funding? Later on, I'll also be providing an update on the impact of OBA or HR1, the massive budget bill, and its cuts to Medicaid and their impact on students and schools. And I'll also be sharing what's going on with Ohio's Medicaid in Schools program now and where we're headed. And so before we get into specifics of the Medicaid program, if we go to the next slide, let's start off really high level. Susie said a little bit about this already, but why are school health services important? Why do schools even offer health services? Especially when providing them oftentimes comes with the thorny and unwieldy reality of working across silos between health and education systems. It's not something that schools have historically done, but over time, we've really come to learn and understand through research and the day-to-day experiences of educators and school leaders just how critical providing school health services is to student educational success. And so we know from national data that approximately 20% of children, or 1 in 4 across the country, have a physical or mental health challenge such as asthma, diabetes, vision impairment, anxiety, or another physical or developmental disability, all of which can affect a child's learning. And for those children within this 20% who are living in, excuse me, I'm getting very cold. For those children who are living in low-income households, of that 20% who have special healthcare needs, we know that 85% of them do not receive needed healthcare. And this is primarily due to financial barriers, geographic barriers, and overall disparities in access to care. And here's where, offering health services in schools makes a lot of sense. Schools are the places where children spend most of their time, and schools can deliver needed services right where kids are, without caregivers having to find time off work or without the costly burden of families accessing care itself, which can also mean the transportation to get to that doctor's office or to the specialist. And this can also take a lot of time. So delivering services in the school setting really can help to reduce a wide range of barriers that students and families experience. For our students with chronic health conditions, we know that access to school-based health services has been proven to improve their health and academic outcomes. In particular, school-based behavioral health services are linked to improved access to mental health treatment, as well as fewer disciplinary actions and higher graduation rates as well. We also know that school-based services can help promote school attendance. Illness is still the #1 reason why kids miss school. And of course, too many absences can lead to a lot of negative things. It leads to chronic absenteeism, of course, but it can also contribute to weaker social and emotional skills in kindergarten, poorer reading skills in 3rd grade, and lower graduation rates in high school. And so, I mean, ultimately, today we have more kids coming to school with health needs that prevent them from learning, or at least learning to the best of their ability. And schools have increasingly stepped in to provide much needed services, and we've seen enhanced outcomes as a result. And so when, for example, a 3rd grader gets reading support for their dyslexia, or when a school psychologist provides counseling to a high schooler who might be in crisis, or when your school nurse administers insulin to a middle school student with type 1 diabetes, it's often Medicaid funding that can and is supporting schools to provide these and deliver these essential services. And so if we move to the next slide, what is Medicaid? So Medicaid, first off, is a health insurance program for 1 in 5 people in the United States. Medicaid and the Children's Health Insurance Program, or CHIP, cover almost half of all children in the United States and guarantee children comprehensive coverage for all medically necessary services, which includes physical, mental, and behavioral health services. Fundamentally, child eligibility for Medicaid is based on their family income. For students with disabilities who have Supplemental Security Income, or SSI, they automatically qualify for Medicaid. And when looking at Ohio, nearly 2.8 million people, or 26% of our total state population, are enrolled in Medicaid as of data from June 2025. And currently, we also know that about 40% of all Ohio students are Medicaid enrolled. Some students or some school districts in Ohio may have nearly as much as 75% of their student population who is enrolled in Medicaid. It can really vary greatly. And we also know that in rural areas in particular, the rate for children enrolled in Medicaid tends to be a lot higher. And so the link I just put in the chat there for you, if you're interested in seeing what the breakdown of Medicaid enrollment looks like in Ohio and for your own school district, just wanted to offer that as a resource.
Great.
And so a key feature of the Medicaid program I really want to stress tonight is that it's a shared state and federal partnership. And the total cost of the program is split between federal Medicaid and state governments. This is a really important feature. As Susie said, in Ohio, Medicaid funding in our state budget is right around $32 billion, and this accounts for 39% of the state budget overall. And because, again, this program is unique as a federal-state partnership, 69% of Ohio's Medicaid spending, 69% of that $32 billion figure, comes from federal Medicaid dollars that our state draws down through this federal and state partnership. And then another key feature of this program I want to share is that state Medicaid plans differ across the country. States have a lot of flexibility to build out their own state Medicaid programs, of course, in alignment with CMS, with the Centers for Medicare and Medicaid Services. And when a state decides it wants to make changes to its state Medicaid plan, which could be around a variety of things like eligibility or to come into compliance with federal guidelines, essentially any state or any change that a state makes to their state Medicaid plan is done through a state plan amendment, or SPA for short, or other type of waiver. The state Medicaid agency submits this to the federal government seeking approval to make any changes to its programs. And so if we move ahead, let's look specifically at Medicaid in schools. So for more than 30 years, since 1988, Medicaid funds have supported the delivery of health services to students with disabilities by paying for physical, mental, and behavioral health services that students with disabilities need to equitably access educational opportunities. As Susie said in the beginning, IDEA is woefully underfunded. And this is where Medicaid plays a really key role for students with disabilities and for education budgets overall. All 50 states rely on Medicaid to supplement and offset the cost of providing services and accommodations for students with disabilities who have an individualized education program or IEP. But Medicaid can also be used to fund and support all students covered by Medicaid. Even if a student doesn't have a disability, Medicaid can pay for needed health services that schools provide. And in fact, we've seen 27 states so far who have expanded their school-based Medicaid program to allow school districts in their state to bill for services provided outside of the IEP. So for those general education students who are not in a special education program. And this is what is known as school Medicaid expansion, not to be confused with Medicaid expansion, which you're probably more familiar with as a key provision of the Affordable Care Act. I'll get more into school Medicaid expansion in a minute, but want to just really make clear the critical role that Medicaid plays in education funding. So Medicaid is actually the fourth largest federal funding stream for schools, behind only federal funding for Title I, school meals, and IDEA. And what we've seen from the most recent data is that Medicaid reimbursement to schools for providing school-based health services has jumped to over $8 billion annually as of data from this past summer. And so moving ahead, remember, Medicaid is a state-federal partnership, and school Medicaid works the same way. This program is jointly financed by states and the federal government. In the graphic you see here, you'll see an incredibly simplified illustration of this process. I don't want Tish on the call to keel over how simplified that first square is, because there's a lot that goes into that for local schools, a lot of time-intensive administrative work that goes into submitting that claim. But this is generally how the funding process works from a high level. So after receiving claims for the time that schools spend providing health services to students, to Medicaid enrolled students, the state Medicaid agency then submits all claims for reimbursement to CMS, who reviews them, then passes the money back to the state, and then the state passes a portion of that back to the school district, which is usually determined by a state's specific formula. And then if we move ahead, I really want to show here what are the services that Medicaid can support in schools. There's actually two distinct categories of services that CMS allows districts to bill Medicaid for and receive money back from the federal government for providing. The first bucket is direct services. This includes a wide range of physical and mental health care, physical therapy, occupational therapy and speech language pathology, nursing services, mental health supports. It can also be screening, supervision, and hearing, diabetes or asthma management, as well as personal care services that assist students with their daily living. This funding can also, I didn't list this on here, but it can also be used for specialized transportation that gets kids with disabilities to school, like even the hydraulic system on the bus that ensures the wheelchair can get to school, and the person who even is on the school bus who assists students in getting to school. And then the second bucket here is administrative services. This can include outreach and enrollment services schools provide for families to assist them with Medicaid enrollment applications and renewals. Medicaid can pay for care coordination, so the referral process of coordinating care for a student with their medical home or pediatrician. And it can also support translation services, providing interpretation and translation related to healthcare services that are delivered. And then on the next slide, the point I want to make here is that Medicaid, of course, pays for healthcare services, but it has to be under certain conditions. First, the student receiving the care must be Medicaid enrolled, not just eligible, but Medicaid enrolled. Then the services provided must also be covered by the state. Again, these services must be allowable under the state's Medicaid plan. And relatedly, the service provider must also be a qualified Medicaid provider included in the state's Medicaid plan. States, of course, must also have the appropriate billing, documentation, and oversight mechanisms in place. And then lastly here, caregivers must, one, provide consent for school health services for the child to receive them, and two, provide another consent for the school district to bill Medicaid for the services provided to their child. And this, as you might imagine, I know Tish will be getting into more later, can be incredibly challenging, and there's a lot of parent education that needs to happen here. And so if we move ahead, I just want to share quickly, I've shared how the school-based Medicaid program works, but now I just want to take a minute to highlight some of those historical milestones in the program to give you that historical perspective. As I mentioned, 1988, schools are allowed to start billing for services provided for students with disabilities. And then in 2014, a really landmark policy change happened. CMS granted states the option of billing for all Medicaid eligible students beyond just services provided to students with disabilities. And again, this is what ultimately we refer to as school Medicaid expansion. And so while the opportunity for expansion really opened a really exciting door, many states also were still seeking more clarification and guidance on how exactly to do this. And so in 2022, the passage of the Bipartisan Saver Communities Act provided just that. It provided more guidance and clarification for states to move forward. And in the next slide, I'm walking through, how the Bipartisan Saver Communities Act really was such a game changer for the school Medicaid program. I think one of the most important pieces here is that it had broad bipartisan support. This is legislation that was passed in the wake of the Uvalde shooting. And it included a set of updated guidance for states on how to implement their program. And it helped start a National Technical Assistance Center that schools and state agencies can, solicit support from in questions and challenges as they're going through them. It also disseminated a series of state grants for states that applied to enhance and improve their programs. And importantly, it set a deadline for states to come into compliance with this new guidance of July 2026, which requires states to submit a state plan amendment by that time if they're not currently in compliance. And this is something Ohio is now underway in the process of doing, and I'll get more into that in just a second. But if we go to this next slide, I just wanted to share a map first where you can see all the states that have expanded their school Medicaid programs to date, or in the lighter green color, have a state plan amendment pending to do so. So at this time, over half of all states, 27, have taken up the option to expand their school Medicaid program so that districts can receive reimbursement for services provided to all Medicaid enrolled students. And then I hope you'll note, like with this map, a lot of policy maps don't look this way. It really just speaks to the bipartisan nature of school Medicaid and how it's been supported. You historically, just in a lot of maps I've seen, you don't see historically red and blue states adopting such a policy in such a widespread way. So I think that's a really important distinction, especially during a lot of times of uncertainty, just to have that backbone of bipartisan support. And so in the next slide, I want to illustrate, why would a school district participate in this program, especially with the 1,000 things that they have on their plate already. Why would they take on the complexity of trying to learn and implement the program? And so while there are a lot of challenges, there are also a lot of benefits. At a baseline, it opens a door to more funding opportunities. And since Medicaid works in this unique federal-state partnership as an entitlement program, there's really no cap on the funding that schools can draw down through the program. Secondly, and the next point I really want to make clear is that even without expansion, schools are still providing all of these services, no matter if the student has a disability or not. Schools are working hard to provide as many services as they can to meet the needs of their students. And these are costs that the districts are taking on directly and fully, if unable to offset them with additional Medicaid funds, for the most part. But with Medicaid expansion, schools can then be reimbursed more for what they're already doing. And then so this is a funding opportunity to sustain what they're doing and then also expand what they can offer and supports that they can provide for their students with that additional funding that they can draw down from the federal government. And so ultimately, if states don't expand and school districts don't participate, then this is really money that's being left on the table. And then finally, the catch-all here is just that these reimbursement dollars can benefit the entire student population. School Medicaid reimbursement dollars go into the general fund of the state and then are passed back to districts. And districts can then make their own local decisions to reinvest back into school school health and school health services or other areas of their local budget where needed. And then I've got just 2 more slides here. This next slide I wanted to share just sheds further light on some of those financial benefits. We do a lot of work at Healthy Schools Campaign to track the impact of expansion across states that have expanded their programs. And I won't go through each of these, but all states, I would say, have been on their own timeline for expansion. Some are early adopters that started to expand as early as possible in like 2015. Others, like Ohio, are just endeavoring on this. And the key point I want to make is that we are seeing these financial gains across these states, but they're not necessarily ones that you see overnight. States that are starting to expand need to really invest time and energy into supporting school districts with learning the program and making the most of it. So bottom line, this program takes time and collaboration, but I hope you'll see from this slide that the juice is really worth the squeeze. And then finally, looking to Ohio and where we are now in our Medicaid in Schools program, or MSP for short, you'll see currently Ohio has not expanded our school Medicaid program beyond the IEP. But the good news is that over the course of the last 4 years, the Ohio Department of Medicaid, with the support of Governor Mike DeWine's administration, which has had a huge focus on school health, has started to engage in a really robust stakeholder process with school districts from across Ohio and a range of different education leaders to learn what they need to understand if expansion is a good route for how to take. And so Ohio is now moving forward with expansion and plans to submit a state plan amendment to come into compliance with a new CMS guidance and then also expand the program. And in conversations I've had with the Ohio Department of Medicaid, I understand that this will include new provider types and services that will be eligible for reimbursement, with a big focus on behavioral health care for students. And this is all expected to be rolled out in January 2026. So it's great news for Ohio students and school budgets, but again, the benefits don't happen overnight. So it's going to be important we check the box of expansion, but then move collaboratively across state agencies to implement the program and support schools to actually maximize these opportunities. And so I know that was a lot, but I'll pass it back to Susie. I hope that provides a bit clearer picture of the program, and I don't want to go more over my time. So thank you.
Oh, well, I think we could listen to you for a very long time. All of that information was really, really helpful. So thanks a lot. So we'll keep going. So let's get Tish's weighing in on this. Can you tell us a little bit more about how Akron is? I know you're very focused on meeting the needs of all of your students, and you will do that no matter what. You were very clear with me about that. So tell us about health, special education, health services in Akron, and your and health services that are covered by Medicaid. And how is Medicaid beneficial to serving your students? Tell us what it's like.
Okay, so yeah, boots on the ground. What happens daily when we're implementing this in the schools? Well, Akron Public has been participating in the Medicaid schools program for a very long time. You had said that in the opening that I've been on the Medicaid beat for about 10 years. And I actually was thinking it's actually been more than 15. It's been about 15 at this point when I had to go back and really realize that. And we've been doing it since inception, I believe in 1988. So Akron has been completely invested in maximizing our participation in the program. And we are a district of an enrollment of about 19,700 kids. And of that, 4,200 qualify as a student with a disability and receive services through an IEP under IDEA law. So special education in Akron Public is a very big deal for many of our students. If you look at that, better said, 1 in 5 of our students are receiving services that could be Medicaid school program eligible for reimbursement. Our Medicaid eligibility rate for all our students is at about 66% right now. For our students on an IEP, that rises to 72% then. So many of our students that are identified as a student with a disability are also Medicaid eligible. The program is really important because it provides a a lot of really beneficial things for our kids. All kids receive, vision and hearing screenings. They receive school health aid services. So, if they're receiving medication at school, they can come and get their medication from our school health aides. They, get a bump or a bruise or a scrape on the playground. They're getting ice. They're being taken care of and triaged by those school health aid services. Some of our buildings do mobile optometry clinics, mobile dentistry clinics. We're providing those kind of services to our students. And then we have counseling services in all of our buildings as well. And then for students that are identified with a disability and that we are submitting claims for reimbursement through the Medicaid school program, those services are, that are Medicaid eligible are occupational therapy, physical therapy, speech and language therapy, school psychology, because they conduct evaluations to determine disability, and then nursing services, and Allison touched on this, transportation services. Not every district in Ohio is created that system to gain dollars for the transportation, but Akron has, and we do participate in that and submit claims for transportation for our students. So it can be very robust for our kids and very beneficial as far as, how is it helping students daily? It's helping them to develop fundamental communication skills and motor skills needed to thrive, not only in the classroom, but in life. We are through audiology services. That's one I forgot to mention. We also have an audiologist that's on staff in our district who's determining if students have hearing impairments, which is then providing, needed accommodations and technology for those kids in our classrooms, providing needed nursing services in real time as that student attends school. It's very important. Students who are nonverbal, we are providing them with communication devices through the dollars that we're gaining through the Medicaid school program. Kids with neuromuscular conditions that need advanced seating options, positioning options, equipment such as walkers, standers, in order to keep their joints and muscles flexible and prevent deformity. We're providing those using those dollars for students in the classroom. So it is real money to us that is helping our students every day access an education and grow in their life skills and in their educational world. Did I answer all of that? You want me to keep?
Yeah, that's really great.
Okay.
It's really clear that I think we may all underestimate the wide range of services that children with disabilities need and how complete the response is. And that is really, really wonderful that that's possible. Can you tell us a little bit more about your role as the person who processes this, how that processing works? I know Allison touched a little bit about the parents' role, but if you want to talk about that as well.
Sure.
And and also the whole ethical issue that you've talked about before.
Sure. So I appreciated that Allison was like, I hope Tish doesn't have an event, a medical event herself looking at the slide when, because it's not just an easy, it's not an easy road and path to just bill Medicaid, the Medicaid school program for services. There are systems that have to be built and procedures and processes that have to be put in place. It involves staffing, it involves training, it involves a number of steps that need to be taken in order for a school district to participate in this program. So it's not a simple as simple as just submitting a claim and getting money for it. There's a lot that has to happen to support it. So, basically every district has to enroll as a Medicaid provider, and that is not a simple task. That takes time. And then every provider that you have, every occupational therapist, physical therapist, speech therapist, anyone that's going to participate and submit claims has to be a Medicaid provider as well. And that process can take a very long time. And we have to do a lot of supporting our staff to stay up on their Medicaid provider status, help them get through certifying as a Medicaid provider, because they have to do it, quite frequently. So the districts have to start there. Then we have to work with a billing agent who is an outside agency that we work with to process those claims. We have to train our staff in how to submit claims and how to do it ethically. We have to train them on how to utilize the system to bill. And then we have to monitor what they are doing, because ethics are a very big deal in participating in this program. Our therapists all have practice acts. They all have licenses that they must adhere to. And we never want to become a system that is saying that we are productivity driven. We are not like a hospital. We are not a clinic. We're an educational entity. And so our first priority must always be the education of the child, not just, is what we are doing reimbursable? Does that make sense? That we are not thinking, I only want to provide this to this child if I can get reimbursed for it. That is not how we operate, nor will we ever operate. It is ethically, if what I'm providing is medically necessary, I will submit a claim for it. If it's not, I don't bill for it. And we have systems in place that pick up if something is not reimbursable, so that we are not putting any of our providers at risk for any type of fraudulent activity or inappropriately billing something. So there is a lot of management and monitoring that has to happen.
Yeah.
Well, and then as far as parents go, we have to, as Allison said, we have to educate the parent on our participation in this program, and they must give us consent to bill for the services. And we have to explain that it is not part of their personal children's Medicaid. And we do not know who is Medicaid, who is Medicaid eligible and who is not. So when we are billing for all students. We are blind to whether they are eligible for the Medicaid dollars or not.
I think that reinforces that ethical, you're going to provide the service no matter what.
Correct.
Right? That's really important to that. Allison, I think you talked a bit about where we are in the process of Medicaid expansion. Did either of you want to add on to where we are in that process and how soon you'd expect to see something actually happen in your communities?
I know for us, we've been told like January, I think Allison, you said that as well, January of 2026 for the expansion. Akron Public is aware of that. We have already started the wheels kind of turning around. We're going to start educating people that are above me that make bigger decisions than me in the district about this, and how, we're starting to say, okay, if we're going to go with the expansion and try and gather as much reimbursement as we can, how do we want to go about doing that? Because there's going to need to be a lot more people involved, a lot more management of it. Again, we are a large district and we're going to expand this to everybody. So those wheels have started to turn, and we would look at possibly seeing the benefits of it probably in 2027, where we're really would be up and running with it and getting starting to get some dollars.
Do you want to add anything, Allison?
Oh, I would just add, yes, January is when we're expected to see kind of the rollout and the effective date, or when we're going to be submitting our state plan amendment to change that policy to the federal government. And I just would highlight the work that how Department of Medicaid has done in leading this process. They've there formerly was more roles actually within the Ohio Department of Education and Workforce dedicated to school Medicaid. And as I understand it, those have been transitioned over to the Department of Medicaid.
Yeah, it was in the state budget.
Right. So, this will be rolled out in January, where I know we'll learn more about, those trainings and technical assistance opportunities schools need. But, would just say what's key moving forward in my mind is just making sure that these state agencies are collaborating and partnering in this work. As Tish said, schools are not hospitals. This is a hybrid program. Schools don't readily operate like hospitals, and oftentimes education and healthcare systems don't even speak the same language. So really for this program to be successful from the onset, we need to make sure that all key partners are meeting regularly and at the table. And in states where we've seen this program works particularly well, that means state Medicaid agencies, state education agencies, and local school districts to collaborate closely. This is really like a three-legged stool that we really try to support across states. So hopefully that adds a little bit more just and where we're seeing this going for now and how it can be successful.
So the final granting of the amended plan, do you see any problem with that happening? Just given the politics of what's happening?
We live in a pretty, there's a lot of uncertainty to put it mildly, but I would say that so far this year, we have seen 2 states have their state plan amendments approved, Maryland and Wisconsin. I know that Utah is also pending a state plan amendment, and they're pretty close, they're pretty hopeful. And I think it's hard to predict what might happen, but we've had a governor who's been a huge supporter of school health services and child health. And even looking back, not to conflate 2 administrations, but looking back in the last Trump administration, we saw the approval of expansion across some of the most comprehensive ones that we've seen in states through the Trump administration. So I'm hopeful is bottom line, is what I would say.
Let's go with that. Let's go.
Yeah, I haven't seen anything to indicate that wouldn't happen.
Okay, so let me just say one more, we'll do one more thing about the local. We know school districts in Ohio are very different. We have very large city districts and we have small rural and we have suburban. Do you want to have would either of you like to comment just on that diversity and how that affects whether or not this Medicaid in Schools program is a worthwhile effort for a school district to participate in?
I mean, I guess what I would say is, obviously, yes, our needs could be very different from a rural school district to a urban, such as Akron City. And while those needs are different, they're equally important though, because every district is serving its population of students based on those student needs. And so I think, the MSP, the beauty of it is that, especially with the expanding, is that it's another tool for districts to be able to serve their students flexibly based on their needs.
Yeah.
I don't know if that's
Yeah.
Those are my thoughts.
And, I'd agree that definitely Ohio's diversity of its school districts is an asset, but it can also, present certain challenges. We know that for smaller and rural schools, for example, they might just not have the administrative support needed to readily launch this program and participate in expanded billing opportunities. Ohio's done a lot of work in this space to try to bring in community partners who can build Medicaid themselves, whether that's through just a community partnership with the school, through school-based health centers, or through things like mobile vans. And that can help in kind of rural and smaller school districts and communities. But then one other thing I would just share that I've seen other states leverage that works well is leaning on their educational service centers. And Ohio has some great ones and other intermediary partners who can take on and handle some of that administrative burden with billing for this program for those smaller rural districts. And these can be just, again, really key partners for smaller schools to stand up their programs. And these are commonly referred to in other states as billing collaboratives or billing consortia. Again, it takes time, and it might take more time for different districts depending on their overall needs and capacity. But again, I just can't emphasize enough, just particularly in this moment and in this education and funding environment, that drawing down additional federal funding is a real asset to schools, and I'm a broken record, I'll just say, worth the squeeze again. Yeah.
Yeah. Okay, so we're going to switch again back to Allison on the question of Medicaid policy at the federal level in the most recent budget bill and its effect on Medicaid participation. So can you talk us through this particular threat to what's taking place here?
Yeah, and I'll try to go through these as quickly as possible. This first slide here, I just wanted to share that Healthy Schools campaign. We worked with the National Association of School Superintendents, the National Association of School Psychologists, and the Association of School Business Officials and CASE to do this survey prior to the passage of OBA, or the big HR 1 budget bill that was enacted this July, just to try to ask schools, what are they using their Medicaid funds for? And how do they anticipate the impact of Medicaid cuts, 1 trillion of which were included in OBA? How do they anticipate that will affect them and their school health services? So I know these slides will be shared later, but you can see here that many districts use these for Medicaid funds for a variety of things to support their school health environment. And then if we move to the next slide, what I think is really illustrative is just what we heard from school districts, over 1,400 different school leaders from across the country, all 50 states and DC, where they think the impact of Medicaid cuts will land on their schools. And 80% said that they'll have to cut staffing because they can't afford to pay for, or they'll just have to curtail how much they're spending on salaries. 70% said they'll cut mental and behavioral health services. 62% said that they'll have to cut student resources, including kind of assistive equipment and technology that students with disabilities really need. And over half said that they'll have to cut preventive services and early intervention services. So this is what they anticipated that impact would be like. And then if we move to the next slide, and actually the next slide beyond that, just note that this is significant in rural districts because they tend to have an outsized Medicaid enrolled population among their students. But then what I thought was really compelling about our survey too is that we heard from 90% of school leaders across the country that they anticipate these cuts will affect all areas of their school district's budget. So we're looking at considerable ripple effects here. And so if you move ahead, Karen, we can skip slide 22 and move on to 23. And so what I really want to touch on here, so HSC, we've been really thinking about the implications of Medicaid cuts in these kind of big buckets, which you'll see in the graphic here. So first off, again, OBA cuts 1 trillion from the federal Medicaid program, that's with a T, trillion, over the next decade. What I want to stress is there is no direct cut to the school Medicaid program. However, these cuts will absolutely have an impact on how schools are able to sustain health services and the funding that's coming into their districts. And because less funding from Medicaid to states, because there's less funding coming from Medicaid to states, this really means some gaping holes in our state budget. And so now it's kind of just a question of, what gets squeezed. States have some options. They could draw from general funds to fill gaps if they're available. They could raise taxes. They could reduce the Medicaid benefits that are currently offered, or some combination of all of the above. We don't know what states will do yet, but this is really a key time to be amplifying why school Medicaid is important and why education funding is important as these decisions are being deliberated. And then if we move to the next slide here, I just want to note that, of course, again, this is going to have a large effect on state budgets, especially education budgets, which on average across the country are roughly 35% of a state's budget. Of course, that changes from state to state. But, and then share here, in addition, because of the federal policy changes included in OBA that impact the Medicaid program, these are things like work requirements, more frequent predeterminations, all that red tape that, just to be clear, does not create efficiency or reduce waste, but rather operates in a way that prevents eligible people from accessing health coverage they're entitled to. These changes will mean that students and families are going to experience greater obstacles to enroll in Medicaid. And what's key for kids is that we know when parents are disenrolled or they lack health coverage, oftentimes so too do their children. And not only, this, but it really means worse health outcomes for children when they experience these disruptions in their health coverage. And then for the school Medicaid program in particular, we know that fewer kids enrolled in Medicaid means less money for schools. And, just again, remember, kids have to be Medicaid enrolled in order for schools to draw down these federal funds. And then again, with less money, schools are stuck making do with less resources to sustain the services they have to provide and continue to try to meet the need. And then just moving ahead here, really quick, I just want to note on timeline and other considerations. So first off, all states will be impacted by Medicaid cuts, but all states will be making changes to their Medicaid programs likely at different times. And so really by design, these Medicaid cuts are staggered as to when they go into effect, which makes it chaotic by design and a little confusing and difficult, I think, to thread that line back to what's really going on here and to tell that story of, how these Medicaid cuts are having an impact. The one thing that has gone into effect now through OBA are changes to eligibility, namely eliminating eligibility altogether for certain immigrant and refugee populations or specific categories of asylees. And then again, just considering all of this like federal uncertainty with IDEA, is it going to be in education or health and human services? There's just a lot of these considerations that we're going to have to take stock of moving forward. And then my very last slide, well, I know these slides will be shared after, but I just wanted to highlight kind of the strategies that we're lifting up to help advocates, to help states, schools, and students to mitigate some of the harms of these cuts. First off, that collaboration across silos in these systems is really key. It's always key, but in hard financial times, it's even more important. We need systems talking to each other during budget discussions because all too often, state systems, especially in budget season, all of these systems play a role in child well-being, but they can be pitted against each other in this kind of false paradigm of scarcity. So it's really important they're collaborating and talking to each other about their goals for child well-being, for family well-being. And then most of the rest of this is kind of intuitive, but you want to ensure that your state Medicaid plans are enabling every opportunity to draw down federal funds that are available for schools. You want to prioritize and invest in outreach and enrollment in schools. This is a reimbursable activity that's really important as so many kids' connection to care and coverage are going to be disrupted. And then we need to really be amplifying the importance of the school Medicaid program. We need to be tracking and monitoring what the impact is to school district budgets, just to be able to, again, tell that correct story of how Medicaid cuts are really having an impact. And this is especially true as well with what we know from the federal level. The National Center for Education Statistics, I think it had over 100 staff, now it has 2. So states, you need to be monitoring directly how this is impacting their program. And I know I'm way over time, so I apologize. So I'll turn it back over to you, Susie.
Thanks. So we are nearing the end, but I wanted each of you to have your final say. There is a lot about this program and about that we need to understand, and about education and meeting the needs of children with disabilities. So what is it that you most want us to think about, or what is the main takeaway you'd like us to have from tonight, and just in thinking about Medicaid in schools? Tish, your turn.
I guess, for me, the thing I would like everyone to take away from is that these dollars that are coming in from districts being able to participate in this program are impacting students' physical and mental health and their skill development daily. The dollars are real and they help children not only with medically necessary services, but they help education deliver on its promise to our Ohio students as they move towards adulthood, that they will leave with the skills they need for their future. And participating in the MSP helps foster that.
Allison?
Yeah, I mean, I think overwhelmingly, I want to leave you with a message of hope. There's a lot of change in terms of policy and funding in such a short amount of time. Again, it's chaos by design. It's hard to follow. But bottom line, the work to support students, to support public schools, to make this world a lot more equitable for all kids has not and is not stopping. Ohio is making some great progress. There's a lot more work to do. But people like Tish, they're working every day still to, support kids. And, I think bottom line, protecting and strengthening Medicaid, which covers oftentimes our children with some of the highest needs, children whose supports have never been funded adequately in our state's education budget. I just want to say that, Medicaid is a sustainable source of funding with no cap that can help offset some of the funding gaps schools are experiencing. And it's really critical for us right now. So we're making great progress. We have to continue working and keep pushing. And the work hasn't stopped and won't. And I hope that we can get a glimmer of hope in a otherwise kind of gloomy environment.
To say the least. Well, unfortunately, we need to draw this to an end. I really think this is enlightening. We know school funding is forever something we have to fight for, that this source is really helpful, and that there may be work for us to be doing going forward to support the full implementation of this expansion. And now I think you have a few more people that understand more about it, so we can mobilize if needed. So thank you again. Just really great information. The final thing I want to mention is that on the 18th, we are holding yet another webinar. The League is sponsoring with the Greater Cleveland League on taxes, yet another part of the school funding puzzle. So we hope you'll sign up for that. And we'll be glad to look at all your questions and try and answer them in the follow-up email that will come after tonight. Sorry, we couldn't really talk about all of them. So thank you all for being here.
Thank you so much for the opportunity. I just dropped my email in the chat if anybody wants to follow up with any questions.
Great, great.
I did as well. And I thank you and the League for this opportunity.
Thank you for so much information. Listening to all these presentations and talking to you, I think I'm getting a better picture. It is really complicated, and it is just amazing. And the fact that we really need to move ahead with the expansion is so important.
Thanks.
And it's hard work doing good work.
A great way to end it. Thank you everybody for joining us tonight, and we will share Tish and Allison's contact information in the follow-up email. Thank you so much for being with us tonight. Stay warm, everybody. Take care. Bye.